An estimated 3 million people live with mental disabilities in the country, with only 3 psychiatric hospitals and 12 psychiatric doctors attending to patients. Some mental health advocates say lack of personnel and infrastructure for mental health patients is what has led to most of these patients roaming on the streets. As part of the effort to enhance the capacity and increase access to community-based mental health care and treatment, civil society actors engaged in promoting the right of women and children and the youth in the northern region have been urged to incorporate mental health programs into their activities to help address the challenge faced by persons with mental disorder. Adam Zokrogu Yaya is a programs manager at Basic Needs Ghana.
Working in mental health and development needs collaborative effort. So we think that going further, we need to broaden or extend the frontiers of our interventions and bringing on board other organizations that are human rights oriented, that support the needs, that promote the rights of vulnerable people. They need to be brought on board, and we think that these organizations are well positioned.
He said there is a need to strengthen community mental health services in order to improve the reintegration of mentally challenged patients into the society after treatment.
To strengthen community health mental services or community mental health services precisely because there is a lot of stigma associated with mental illness. We think that people who are experiencing mental ill health should be treated in their own communities. They should be treated in the locations where they are. And when that happens, reintegration is not a problem. Reintegration is not a problem because the person is already in his or her community.
The program's director for Ason Taba, Lamnatu Adams, said mental disabilities could be related to women being accused of witchcraft in the society.
If you look at the conditions that people who suffer mental health are put in, is the same conditions that women who are accused of witchcraft are put in. They face isolation, just like the alleged witches do. They face rejection. They are not welcome back even after they live in the camp. They are banished and they are left to live with the, in their own, just like what happens to women accused of witchcraft. And for me, I think that we should begin to look at what relationship that also exists in people's mental illness. Talk about depression, for instance. Talk about health of women and how it relates to witchcraft accusation. So it relates so much in what we do. And I think that we need to forge ahead and see how best we can support to raise awareness on how to treat persons living with mental.
Civil society organizations believe collective actions will enhance the promotion of the rights of mentally ill persons. From Tamale, Nuwanash for Versa One News.